just
Call them
email,
tonight.
call their cell phone, whatever
Yeah.
you have. The number for the State House is 722-2000. And you can just call over and ask to speak to your representative. And you can call Healthcare for All to figure out who your representative is. You can look it up online. And we're just so hoping that this can happen for all these people and really to keep our whole state healthy, keep our providers, our doctors, and our hospitals healthy, and our individuals and our families.
So that's great. So it's not over yet.
It's not over yet. Our fingers are crossed.
Final gavel is down. So hopefully people can still call in. And again, I mean, one of the reasons I think health reform is such an important issue is because it's not a election year sort of topic. It's like any time of the year, all year long, people are affected by health. And so it's never, what do you call it, an issue that's not, it's never not a hot topic. It's like it's affecting so many people. And so regardless of what happened to them, people should still get involved and make sure that this is something that they continue to have and that sort of, so a lot of time when you get certain things, you take it for granted until you may not have it. And so I'm hoping people will really sort of become more active and proactive in terms of making sure that the representative, do the right thing.
And there are so many ways to get involved. There's Healthcare for All, and then we work in coalition. So we work with the Greater Boston Interfaith Organization, which has a lot of congregations in Cambridge as well. We work with 1199 SEIU, which is a labor union, which works a lot with Cambridge Hospital. And then all of our health centers, all of our hospitals, the American Cancer Society, AIDS Action, so all of these different groups. It's a very broad coalition, and individuals can get involved in any one of those organizations, whatever feels right for you. If you want to come and work on healthcare, there's so many entry points to the system.
So that's great. Like I know initially we were going to talk about the Watch Your Mouth campaign, and so before we continue with CommCare, I wanted to talk a little bit about what the initiative is about, and I'll probably direct people later on where to get more information. So just in a few words, sort of what that initiative is about.
Sure. So Healthcare for All works on a number of different areas. I get to do health reform, and there's another area, which is our oral health team, and a program called Watch Your Mouth, which talks about all of the many ways to keep one's mouth healthy and how that is really the entry point to the body. And so it is, oral health is full body health, and so it's talking about the importance of fluoridation, the importance of having access to care, and really working in a multimedia way all across the state to make sure that kids, for the most part, have healthy teeth and grow up healthy.
Great. And so that campaign is also online, and so people can go back to that website we mentioned earlier and see a clip. I've seen the PSA all over the place.
Yeah.
Random time. So
yeah, and a lot of that is local community organizing. So there's a number of local communities in Massachusetts that don't have fluoridation in the water, and we have campaigns where mothers and fathers and sisters and brothers are coming out and saying, this is important to me and to my kids or to my little sister that there's fluoride in the water. And so it's another way to get involved.
To get that covered. Great. So, we'll probably have more later and have someone come and talk a little bit more about this particular campaign. But again, it's like all these issues are so critical. You can't really sort of pick one or choose one. They all matter and they're affecting everyone in the state. And so, I think that's why it's so important to, to have health reform or to have people advocating for others who may not have enough or don't even have any at all. And so with the policy itself, are there other sort of policy issues on the table right now that you're working on besides the CommCare?
Yeah, so this is the main one, just making sure that in the budget there's enough money so that everybody who needs it is able to access health care. And it's really hard because the economy is so tough right now. The budget for people and their families is tight, but for the state too. And so just when individuals and families need more assistance, the state is less able to give it. And this is the conundrum that always happens as we cycle through, the ups and downs of the fiscal climate. And so it's hard as people may be losing access to prescription drugs or access to a lot of public health programs. So there's a number of places that we're looking at. And certainly this issue is top on our agenda right now. There's something else that we're working on a lot, which is outreach and education regarding the plan. And so there are a number of local community groups, Healthcare for All included, who are trying to reach out to folks who may not be covered or may have trouble staying on coverage and help them figure out what those access points are. And then more importantly, when you do get coverage, how do you use it?
Right.
Because if 430,000 people now have coverage, it's for the first time for many of them. And if you've never had an insurance card, You don't know when to go
What
see a
it
doctor
is,
and when to
right.
go to the emergency
Yeah.
room. You don't know when to have your well visits. You don't know what a checkup is.
Right.
And so you can't just give people an insurance card
And say,
and assume they know
what's
how to
gonna
use it.
happen. So the other piece is it's not just policy, because a lot of time one of the things I don't particularly like is it's one aspect. So whether it's a bill that's there or the policy is
Yeah.
done, then you're like,